I'm Lou Carta of the Middletown Health Department, and this is Healthline. Suicide, it's a major public health concern and a leading cause of death in the United States. Suicides and suicide attempts have a ripple effect that impacts families, friends, colleagues, and communities. It's complicated and tragic, but suicide is often preventable. Pam Maude is here to tell us why recognizing the warning signs of a possible suicide and knowing what to do can help save a life. Welcome to Healthline. Our guest today is Pam Maude. Ms. Maude is the director of the Alliance for Prevention and Wellness based in North Haven, Connecticut. Pam, thank you for joining us today.
Thank you for having me, Lou.
Why don't you tell us a little bit about what your organization does?
Sure. So the Alliance for Prevention and Wellness is a program of BH Care, and BH Care is a local mental health authority. And so what the Alliance for Prevention and Wellness is we're one of the Department of Mental Health and Addiction Services regional behavioral health action organizations. So there's 5 acronyms RBHAO across Connecticut. So we cover the 34 towns of New Haven and Middlesex County. And a little bit about what we do is we work in partnership with the community and various community partners from all various sectors to assess the behavioral health needs of children, adolescents, and adults across the region. We develop regional strategic plans, including priority recommendations for prevention, treatment, and recovery services. So we cover the lifespan and the continuum of care. We administer the local prevention council fund. So each community in Connecticut has a local prevention council, which is a grassroots coalition working to address local substance abuse problems. We build the capacity of our local communities and on a sub-regional level to understand and address problem gambling and also to address suicide through suicide prevention.
So it's a wide array of services, and obviously suicide, what we're talking about today, suicide prevention, is part of that. How common is suicide in the United States today?
So suicide is very prevalent. It's one of those public health issues that people are very uncomfortable with. People don't like to talk about the S word.
There's a stigma attached to it. Mm-hmm.
Yeah, so there is a stigma and there is a shame. So here in Connecticut, it's the second leading cause of death among 15 to 24-year-olds. And it's the second leading cause of death among people aged 15 to 34 in Connecticut. And we also have seen an increase in the 50 to 59-year-old population in Connecticut. Recently there was just a public health alert put out through our state departments, and we've been really trying to get this out locally as well, but it's the Connecticut Public Health Alert on Youth Suicide, a call to action, because tragically in the past 4 weeks we lost 4 young teens to suicide here in Connecticut. Suicide is really an issue that affects everyone. So it affects, it doesn't matter on your race, it doesn't matter on your gender, and it doesn't matter on your age. It's something that impacts everyone across the lifespan. And
do we see the numbers going up, let's say, from 10 years ago, 15 years ago, proportionally within our population?
So in Connecticut, our rates have remained pretty much steady. Unfortunately, we still have too many suicides. I mean, they have gone up slightly in the past few years. So, for example, we have more than 1 suicide a day when we look at the over 370 suicides we've had in the past year. So it is something that we should be concerned about because 1 suicide is too many.
Yeah, and for every suicide, there must be probably more suicide attempts.
Correct. So there are usually more suicide attempts than there are deaths by suicide. And it's not just that the impact, but the impact is the survivors of suicide. So those loved ones that are left behind from someone who died by suicide. And it's also the others who are impacted that are not immediate family members from a suicide. So a suicide really does have many ripple effects. That
ripple effect would include maybe friends and family, colleagues at work, things like that. And how is it? You said it impacts them. Obviously it does, but how so? Why would a colleague, for instance, maybe somebody that doesn't even know that person too well, sometimes they get affected pretty deeply? What do you think is the connection there?
So there's various reasons of why people are affected deeply. Sometimes it's they feel maybe they didn't see a warning sign. For others, it's just it may interrupt their normal part of the day. So, for example, a colleague or a coworker, if you're coming in and seeing that empty office or that empty desk at school. So you really have to look at it as it has that ripple effect because it can affect folks, even if it's just someone they were friends with on social media. Someone that they're connecting with, it's impacting that connection that they've had with the person.
And at what point would that person that was affected by the suicide or suicide attempt, what point do you think sometimes they may even need counseling just because they've gone through this process?
Mm-hmm. Yes. So it's when they're thinking about it or it's causing a disruption in their life or an impact, or maybe they're not feeling slightly the same as they used to. Maybe it's creating some type of uncertainty or feelings of anxiety. It is good for them to, seek help.
And it could also be, what could I have done?
Mm-hmm. The survivor's guilt.
And let's talk a little bit about those warning signs that people should be aware of for a person who is thinking about committing suicide.
Yeah, so, again, there's not one known cause of suicide. It is extremely complex. We do know that there's risk factors that tie in with the warning signs. So some of the largest warning signs are if someone's threatening to hurt or kill themselves, and especially if they're posting things or they're saying things such as, you'd be better off without me, you don't have to worry about me anymore, I'm not going to be here tomorrow, or if they're looking for ways to kill themselves. Are they seeking access to means? So are they seeking access to weapons or other types of lethal means? Are they talking or writing about death, dying, or suicide? These are all really high risk factors that we need to take seriously. It could also be, are they posting lyrics of songs or artwork that seems dark? So it's important that we kind of peel the onion back and ask questions of, I've noticed that you've said this. Can something be wrong? To engage them in the conversation. And it's really important how we ask the question and that we're direct in asking the question of if they're thinking about dying by suicide or if they thought that they want to go to bed and never wake up. Other things that are some warning signs that you might see is the person hopeless. Is there hopelessness? Is there rage, anger, seeking revenge? Because that can also be a warning sign. Are they feeling trapped? Are there things in their life that are making them feel trapped? And that could be a variety of different things that would make someone feel trapped. It could be finances. It could be a bad relationship. It could be the thought of being incarcerated. So, there's other things such as, are they using alcohol or other drugs? We know in suicide prevention, when we have an upset person, substance use, and a firearm, it's what we call the lethal triad. And if we could remove one of those factors, we could reduce the risk of suicide by 50%.
Do you think a lot of people are reluctant to intervene, though? You mentioned a person crying out for help, but sometimes people think, well, that's just somebody acting out. How do you make that differentiation between that and an actual suicide contemplation? You
should always take it seriously and ask the question. And yes, people are very hesitant to ask the question because many times people don't feel like they have the resources on how to effectively intervene. But what we know from suicide prevention research and evidence-based practices is that if we could provide hope to the person, we can greatly reduce the risk of suicide. And many times when you ask the question of, are you thinking about taking your life by suicide? Are you thinking of dying by suicide? Do you want to kill yourself? When you ask the question in those ways, you may be the first person who is asking the question. And many times it gives the person relief that someone is asking the question because they've been thinking this way.
You're listening to Healthline. Our guest today is Pam Mott, and she is the Director of Alliance for Prevention and Wellness in Connecticut. And our topic today is suicide prevention. You had mentioned talking about some of the signs and motivation, actually. You had mentioned revenge. Now, I find that interesting aspect of it because somebody actually is thinking that if I die, it's going to make you feel bad or guilty anyway. Is that the correct interpretation of that?
It could be one interpretation. It also could be seeking revenge. It could be, based on many different things. Again, there's no one reason for revenge. Sometimes it could be based on an intimate partner relationship. There could be revenge there. It's really individual. As I mentioned, suicide is a complex problem. So when you look at that topic of revenge, it could be a variety of different issues, and it could also be just one of those factors. There may be much more going on with the person that we don't know about.
Would you say it's more of a mental issue or emotional issue or a combination of both?
Again, suicide is very complex. We know that there are different types of mental health conditions that would put someone more at risk for suicide than others. But it can, it can be mental health, but it can also be other factors that contribute. Again, there's not one simple solution of what the cause of suicide is. For some, maybe they're dealing with chronic illness and pain. For others, maybe they perceive themselves to be a burden. For others, it could be a traumatic loss. It could be that they've lost a loved one to illness or disease or to suicide. For others, it could be lack of social isolation support. Even during COVID-19 right now, nothing is the same that it used to be. It's really changed and disrupted people's lives, not just in youth, but also in adults. So people can feel different burdens. So if they're feeling that they're burdened, and, that could be when I mentioned earlier, someone feeling trapped, maybe they're feeling burdened by everything going on with COVID-19. It could also be related to humiliation. So there's so many different factors that go into suicide. And then, are you at a higher risk if you have a different mental health condition? Yes. And then you stack on other things. So again, there's no one clear cause.
So if a person sees this change in somebody that they know, but don't feel confident enough to intervene, what can they do?
So I always encourage everyone to have resources available. When we do suicide prevention trainings, what we do is we encourage everyone to put the crisis line in their phone. Everybody has usually a mobile device attached to them, not everybody, but access to it. So we always say the crisis talk line, 1-800-273-TALK. We also encourage folks to have the text-to-chat line 741-741. They can text that number to have resources, because you may not be the person that's comfortable asking the question, but you can help bridge them to someone who may. There's, all of us have the ability to increase protective factors. So in someone who we might be concerned about, so some of those things are bridging them to effective clinical care. And sometimes it's bridging them to just their primary care provider, because maybe they're uncomfortable making a call to go see a therapist. Maybe we sit with them and make that call, because that can be very scary for some folks who have never utilized those services. And then other statewide resources that are available. Connecticut has a wonderful statewide website, preventsuicidect.org, that is a wealth of information. Upcoming trainings are on there, resources, anything you want to know.
A lot of good information. Pam Mott, thank you for being our guest today in Healthline. Healthline is produced by the Community Health Education section of the Middletown Health Department, which is solely responsible for its content. Please join us again next month at this time for another edition of Healthline.